Hello everyone, welcome to another video. My name is Dr. Surakshith Battina, and today we're going to discuss about a topic which is very close to my heart, that is of course endometriosis. Endometriosis is a benign inflammatory condition wherein the endometrium, which is supposed to be inside the uterus, deposits or grows in areas which is outside the uterus. Now when this tissue deposits inside the pouch of Douglas, which is the empty area behind the uterus, it causes a lot of adhesions and inflammation, causing pain and infertility. Now when the same endometrial tissue deposits inside the ovary, it causes endometriomas, which of course become large in size, and they also have a chance of rupturing. These endometriomas are also known as chocolate cysts because of the color of the fluid which is entrapped within the ovary, which is usually brown in color. Now the exact reason of why endometriosis occurs or spreads is still unknown, but we all know it behaves like a malignancy, slowly creeping and spreading inside the pelvis. Now you'd be all wondering, endometrium is something which is very physiological, which always sheds out of the uterus, so why is it a problem when it sheds inside the pelvis? Now the main concern here is that the endometrium, which is trapped inside, causes a lot of inflammation within the pelvis, and this inflammation in turn causes a lot of adhesions, and of course we all know adhesions near the tube and ovary will cause a lot of damage to the tubes, and of course causing infertility at the end. In much more severe form of endometriosis, this endometrial tissue deposits inside the neighboring structures, causing nodules, and when these nodules occur within the bladder or the ureter, they cause urinary problems, and when these nodules are inside the rectum, they cause defecation problems, and if these nodules are found within the vagina, they cause severe pain during sex. When a woman experiences a lot of pain during a period and it really hampers her day-to-day activities and she's unable to do anything else, that's when a simple ultrasound scan will be able to identify if the woman has endometriosis or not. Now coming to treatment, it all depends on the age of the patient coupled with the severity of the endometriosis she has. For young unmarried girls with mild to moderate endometriosis and very small endometriomas, an expectant management is more than sufficient. All she has to do is come into the gynec's office once in every 5 to 6 months to assess the progress of the disease. Now if the girl is suffering from severe cyclical pain, then a surgical clearance will be recommended for her. However, it is very important to delay the primary surgery as much as possible. For women in their reproductive age group who are suffering from infertility, we would usually do a surgical clearance and restore her anatomy, and at the same time remove these ovarian cysts. The reason why we remove the ovarian cysts is because they can damage the follicles inside the ovaries and reduce the woman's ovarian reserve. And we would usually start the woman on ART or infertility treatment as soon as possible to expedite her chances of becoming pregnant. If you want me to make a separate video on all the ART procedures which are available for women suffering from endometriosis, do let me know in the comments down below. And do remember, the first surgery should be the best surgical clearance for the patient, because inadequate removal of this tissue might really be detrimental to the patient and she might develop endometriosis much faster than otherwise. And it should be performed by a high volume surgeon who can attain a good amount of endometriosis clearance. In my humble opinion, a 3D laparoscopic clearance is way more efficient than a 2D laparoscopic clearance because it gives the surgeon a better depth perception, and we would be able to perform much more efficient surgery in a much shorter period of time. Although robotic surgery is the future, in its current state, we cannot recommend this to women who are suffering from endometriosis because of the large size of the incisions which are required for the robotic arms, and at the same time, because the large clunky setup process, the patient has to be under anesthesia for much longer periods of time. Anyway, that's the end of the video. Thank you all so much for watching. If you enjoyed the video, go ahead, leave a like for this video, and for more such content, do subscribe to my channel. Until the next one guys, see you and have a great day.